And Nina Vos is a senior researcher at Wageningen University in the Netherlands. And she will specifically talk about, take us in the angle of COVID-19 to reflect on how COVID-19 has exposed fragilities that we now need to consider. Nina, over to you. Please share your screen.
Thank you, Namokolo. Can you hear me?
Nice and clear.
I think people can hear me, so thanks for giving me the opportunity to share some of our research findings. So my name is Nina de Roo. I work for Wageningen Center for Development Innovation, which is part of Wageningen University and Research. And I would like to share with you some of the findings that we did on a study on the impact of COVID-19 as one of the shocks on food systems in 4 countries. So when COVID-19 pandemic spread across the globe, it became clear that the virus and the measures taken to stop spreading it would have significant effects, not only in the north, but also in the global south. Initial macro-level modeling and scenario assessments on the impacts of COVID-19 provided insights in the effects on the global economy and national food systems. However, as time went by, there was an increased need for more specific assessments of COVID-19 induced impacts that are based on real and grounded data. So financed by the Dutch Ministry of Foreign Affairs and in close collaboration with international partners such as IFPRI and GAIN, Wageningen University initiated 4 country-level studies with a particular focus on in-country knowledge, perceptions, priorities, and options to respond to the pandemic. So we did that in 4 countries, Kenya, Ethiopia, Mali, and Bangladesh. And the aim was really to provide an overview of the impact of COVID-19 on the food systems. The focus of the studies was really to look at the impact on specific vulnerable groups. And our approach was to work closely with local in-country partners and their networks and use their collective knowledge to synthesize existing reports and determine priorities for short-term and medium-term actions. These studies were really rapid assessments. In total, they took more or less 7 weeks, all in all. And as you can see from this picture, the involvement of local stakeholders was really pertinent and crucial, and also complementary to what was done already in other studies. So we collected no new data. We actually used already existing available reports, and we relied heavily on these in-country networks. A cautionary note to mention is that these studies were conducted actually in May and June. So some of the findings that I will present to you may be a bit outdated, and we do see the need for repeated assessments. So this is just a cautionary note. In this session, I will also mainly not focus so much on the facts and figures, which you can find in a detailed report, but I will present to you the overall picture that came out of comparing those 4 countries and the impact on those 4 countries. So we use the food systems approach as outlined by Van Berkem as our main framework, which you can see here, and I will go into each of the 4 main elements of this food systems approach. So first, the drivers, so socioeconomic and environmental drivers that really have an impact on the food systems of the 4 countries. Sorry. So in terms of drivers, we identified mostly socioeconomic and environmental drivers. And it's good to mention that in many of the countries that we work in, COVID-19 is only one of the shocks that is impacting those systems. For example, in Ethiopia and Mali, we know there's political unrest, which is heavily impacting the country's food system. There's also other issues like the locust disease, which was affecting mainly Kenya and Ethiopia, for example, and there were climate-related shocks. So these all have an impact on the food systems of those countries. In terms of the activities, how COVID-19 impacted the food systems activities, we really found that So we saw major declines in export of cash crops, and this was also really outlined by the majority of the reports, which focused really on the cash crops and on the formal sectors. And we found a bit of a contradiction because most available studies emphasize these formal export losses. Other studies and our local experts mentioned that these studies underreport the challenges in the vast majority of agricultural activities, which are performed off the radar by smallholders and SMEs who produce for self-consumption. So in all 4 countries, we really saw the smallholders and SMEs faced major problems with input availability. So we talk about seed, fertilizer, finance, labor, and we saw that female-headed households, which are already affected a lot by these constraints, were affected the most, actually. And access to finance is really an issue. It's already an issue, but due to COVID, it becomes even worse. Because informal moneylenders, who are an important source of finance, they were not able to perform their trade activities, and as such, they cannot pre-finance the agricultural season. And again, we saw that female-headed households are mostly excluded from input finance. Also, another important finding in terms of activities was a real mismatch between demand and supply of casual labor. There's a huge shortage on farms in terms of farm labor because people cannot travel because of the mobility restrictions. But on the other hand, we also see that young students and other people who live in cities and lost their jobs, they return back to their homes in the rural areas and start to produce for themselves. So they would also be able to provide casual labor. But this mismatch was not solved, at least at the time of the study. We also saw significant disruptions in the supply and transport of food, as the lockdown prevents traders and farmers from effective transport. And we saw really that most governments do not have a robust social safety net, for example, for casual laborers and other actors in the informal food economy, which is really hampering those actors. And we saw, lastly, that fresh foods, such as dairy and fresh vegetables and fruits, are being wasted because at the one hand, the demand drops, and at the other hand, the transport is limited. So in terms of the outcomes, I will focus mainly on the outcomes in relation to food security, because it's the objective of this session also. So in general, we saw that the health systems of the 4 countries are really under stress, mainly in Ethiopia and Mali, as these countries have very limited resources to maintain their regular health systems, let alone with the additional health crisis. We also found that public myths related to food safety and COVID-19 caused in several countries that people consumed less nutritious food. In Bangladesh, for example, we saw there was a rumor that dairy would affect the immune system. And in Ethiopia and Kenya, we saw that there were myths around uncooked vegetables that would increase the likelihood to contract corona, which had an effect on the consumption of these commodities. On the prices of food, we saw mixed findings, so I won't go into detail about those. But we did see across the 4 countries that food affordability was really a major problem, particularly for the poorest of the poor. And we found that most households actually coped with that by reducing the number of meals and by going mainly to staple food, so the main grains. And nutritionists warned that governments focus too much on calories rather than nutrition diversity. That's also a finding we saw across the board. In terms of the vulnerable groups, what comes out very clearly is that already vulnerable groups really become affected more. And we saw, especially in Ethiopia and Mali, that there is a significant increase of malnutrition, as you can see here by some of the findings that we collected. For example, in Mali, it was expected that 2.2 to 2.7 million people will be severely food insecure, amongst others, because of the impact of COVID-19. And also, we saw we found that the long-term impacts of lost months of schooling and nutrition will be particularly severe for children in poor families, because it will jeopardize their development of human capital and their earning potential in the future. And also, casual laborers do not have stocks to draw from, so they will be most likely to really be affected by lack of food availability and affordability. So who is most vulnerable? we identified across the board 5 groups which are really vulnerable, and you can see here also what their particular vulnerabilities are. One of the groups which we found most vulnerable because of COVID-19 is feeble-headed households and young females. They do play a crucial role in the informal food economy because they, for example, in restaurants or as street vendors or retailers or producers even, but because they're in the informal sector, they are often ignored by formal support programs. If they do have a job, they often don't have laws to protect them to get the virus, for example. But mostly we actually saw that they lose their jobs and they have limited coping strategies. So here you can see also for the other groups what their most vulnerabilities are. I would like to spend the last minute of my presentation on the implications of this study. So what we see is that already vulnerable groups are hit the hardest, such as female-headed households, female service providers, and female refugees. Appropriate support is lacking, as they mostly operate in the informal economy, and most government systems are targeted towards the more formalized sectors. So business as usual is really not an option, because it's rather clear that existing inequalities are getting worse. And what we also found is that COVID-19 is only one of the shocks that is impacting the food systems in such countries. So only looking at this isolated shock may not provide the answer. So we need systemic approaches to structurally address these interrelated problems. We also see that the informal economy is quite resilient and adaptive already, but this remains largely unnoticed in most studies due to a bias towards the formal and export-oriented sectors. In terms of the process, what we really learned is that local grounding and in-country networks bring really a complementary perspective, and it increases the ownership over findings and over the follow-up actions. And this local perspective is also crucial to identify the most vulnerable, as well as their coping strategies and needs, and appropriate support, which is not happening by studies which mostly focus on those formal sectors and the larger companies, for example. So these studies have been done with all these people, so I would just like to briefly mention them. And this was it.